Hi, and welcome to our video on the facial nerve. Today, we are going to tell you about this nerve's function, location, and what happens when things go wrong with it. So, if you need to remember the functions of the facial nerve, just think fast. F. That's the easy one. That's for facial expression. There are many muscles that control facial expression, and they are all innervated by the facial nerve. As an example, orbicularis oculi closes the eyelid. In the nasal group, the procerus and the corrugator supercilii muscles draw the eyebrows inferiorly and medially. Finally, orbicularis oris and the buccinator muscles press your cheeks and pout your lips. Our next letter is A, which stands for anterior 2/3 of the tongue. The facial nerve provides sensory information to this part of the tongue. The anterior tip of the tongue mainly tastes sweet and salty tastes, while the lateral portions are mainly sensitive to sour tastes. The letter S stands for salivary glands. Parasympathetic branches of the facial nerve innervate both the sublingual and submandibular glands, which secrete saliva through these ducts. Finally, T is for tears. A branch of the facial nerve supplies autonomic innervation to the lacrimal gland, which secretes the tear fluid, which protects the eye. Now that you know the functions of the facial nerve, let's have a look at where it originates. Like most cranial nerves, the facial nerve originates from the brainstem, specifically the junction between the medulla and the pons. It is the seventh cranial nerve running in tandem with the vestibulocochlear nerve, which is the eighth. Now let's look at a horizontal section to see how the nerve exits the skull. This is a top-down view of the base of the skull. The facial nerve enters through the internal acoustic meatus, passes through the facial canal, and exits through the stylomastoid foramen. It moves towards the parotid gland where it splits into three main branches, the temporal, zygomatic, and marginal mandibular branches, through which it innervates the muscles, glands, and tongue as addressed earlier. Particularly relevant to the pathway of the facial nerve is a condition known as Bell's palsy. This is where the function of the facial nerve is impaired, causing weakness and paralysis, usually on one side of the face. It is the most common cause of facial paralysis. There are numerous causes of Bell's palsy, but one of the most common is an inflammation of our nerve. This is a particular problem for the facial nerve as it exits the skull through the very narrow stylomastoid foramen. Consequently, the nerve is compressed, disrupting signal transmission, which presents itself mainly as face drop. However, the other symptoms, such as dry mouth and eye irritation, can be explained by the disruptions of the functions we explored at the beginning of the video. Luckily, the prognosis for Bell's palsy is usually positive, as the inflammation can be treated with corticosteroids and patients usually recover within 9 months.